Hi, I'm Josie Hentzen, and I'm the program coordinator for Healthy LifeStars. Here with me today is Sofie Dollison, who is the assistant program coordinator. Today, we're going to talk to you about Healthy LifeStars and how we have adapted our program in the COVID-19 world. So our objectives today are to show you how we've adapted our program in this virtual world. We're planning to educate you on our current resources that we have available, as well as increase your awareness of the Healthy LifeStars program in order to expand it statewide. Our agenda today is to briefly overview the Healthy LifeStars program itself, how we've adapted our program, the creation of the video lessons that we've utilized to adapt our program, our efforts that we've made in order to collaborate with others, and how we are now promoting and delivering the program, as well as the plans that we have for the future. So to start, I will give you an overview of Healthy LifeStars. So Healthy LifeStars is a national nonprofit organization that originated in Arizona and spread to Ohio, Colorado, and Iowa. Their mission is to motivate and educate kids to live active and healthy lives now and in the future. And this program does so by providing a set of tools that integrate three fundamental elements of a healthy lifestyle, which include physical activity, nutrition, and goal setting. So the Healthy LifeStars program utilizes a Healthy LifeStars curriculum, which has been evaluated through focus groups and have found really great outcomes. So currently there are 36 lessons available, and these lessons teach 3 healthy life habits, which include I am active, I eat right, and I can do it. These healthy life habits also incorporate physical activity. So our lesson plans touch on these 3 points and then utilize some sort of physical activity to keep the kids moving. So right now, all of our lesson plans and incentives that we give to our students are provided to our coaches. And I'm not sure if I mentioned this, but our program is geared towards elementary age children and can be utilized in after-school programs, elementary schools, and other child-serving organizations. Our program is provided to all of our partners at no cost due to generous donations that we have received. So typically, our program does operate in person, like I mentioned, where we either have coaches go out into the after-school programs to teach the program to the kids, or there are site staff that lead the program. But obviously, due to COVID-19, we are no longer to be in person with the children. So we've had to adapt and shift our program. So in response, we initially created these 30-second short videos, and this was our short-term response. And this was to continue our Healthy LifeStars programming during the uncertain time and to keep our branding out there, as well as to expose the kids to our normal healthy habits that they were originally learning, and to teach children about how to make healthy snacks at home, how to be physically active at home, all of the things they were learning at school from our program that they were now missing out on. We have provided a few of these challenge videos for you all to view, and I think that the links are also listed in the description below. When we found out that COVID-19 was here to stay for a while, we had to develop a more long-term response. And to do so, we created these 8 to 12-minute video lessons that were based on our current Healthy LifeStars curriculum. So the 36 lessons that we have available, we transitioned those into a video lesson that could be viewed in a virtual setting. So the purpose of this was, like I said, to expose children to the lessons that they would have been able to view in person in a virtual world. And currently we have 12 of these video lessons that are developed. And in these lessons, we utilize our Healthy LifeStars coaches, and we also include animation as well as physical activity elements in order to provide an interactive and engaging experience for the students. We have also provided an example of one of our video lessons here on our lesson, the introduction to I Am Active. So this one is about 10 to 12 minutes, I believe, and we will provide the link below.
So now if we look at video creation, this was kind of an intimidating process at first, but we started with existing Healthy LifeStars lessons, which have sections including the focus section, engage, review, activity, and then the wrap-up section. And we took each of those sections and just altered them a little bit to turn them into the video script. So traditionally, the lessons have this question and answer format where the coach is asking a question and the students are answering the question. So when we did the video creation, we had to kind of internalize that answer and provide different ways like animation or pauses to pretend as if the children were answering, and then have the coach or animation voiceovers take over that response section. So then for a brief kind of overview of our process, after we adapted the script, we would film coach videos, edit those videos down exactly how we wanted them, upload them to the software we are using, which is Powtoons, add any voiceovers that we have for those animation slides, actually create those animation slides, and then finally review and export them so that they can be delivered to our participants. With these videos, we really wanted to bring a ton of people together to collaborate so that we could provide the best program possible to our participants. So with our short-term response, our challenge videos, we invited our existing volunteer students to engage and create those 30-second videos, which we then edited on top of those. And then we also invited student athletes at the University of Iowa to participate in those videos as well. And we graciously had a response from them. And then with our long-term response, the video lessons, we invited our volunteer students in as well. They did smaller sections of the script, typically shorter parts of an activity section or parts of a review section. And then we invited experiential learning students in as we're working on our second suite of video lessons, where they work with the staff at Healthy LifeStars to actually write, film, and animate those videos to, again, just provide the best video quality we can to our participants.
So now we are in the program delivery phase of the adaptation. And so currently all of our video lessons are available to all of our current partners. So those that were receiving in-person programming. We are currently developing new partners, as well as we are welcoming all new partners. So like I said, our program is free of cost. And so in order to get set up, all that you need to do is reach out to me. And I've left my information below. So it's just Josie Hentzen at U Iowa, and feel free to contact me with any questions and I can help you out. So I guess our next steps are to expand our program statewide, like we mentioned before, and we're also working on developing a medical model. So we had heard of need from some providers in the area that they were wanting to utilize our Healthy LifeStars program, or they had individuals coming into their clinic that they wanted to refer to the Healthy LifeStars program, but Healthy LifeStars wasn't operating in their community, so they weren't able to go to a site to participate. And so the idea behind this is to have a platform that has all of our video lessons in one hub, and kind of and includes modules that the user has to progress through in order to work on these individually and as a family. So that way providers anywhere could refer children and families to our program without having to go to a specific on-site location. So that is our presentation for you, and we have left our contact information here. Like I said, if you have any questions or if you want to get involved, feel free to contact Sofie or I at the emails listed above. And if you want to look at any more information about the program, we have also left our website addresses here. Thank you.
Thanks.